Dear colleagues, I'm going to brief you a little bit about the St. Gallen International Breast Cancer Conferences. The next one, the 13th edition of this conference, taking place in March 2013, from March 13 to 16. Quite a lot of 13s. The St. Gallen International Breast Cancer Conference is one of the outstanding breast cancer conferences worldwide. Unlike San Antonio or other national breast cancer conferences, it is not concerned with breast cancer overall and on the whole. It is mainly and exclusively concerned with the primary curative treatment approach to the disease. It is concerned with early breast cancer only, from the surgical part to radiology, radiotherapy, to the important field of medical adjuvant treatment in its many facets of today. Why should you attend this conference? It is the only conference worldwide where the primary treatment of breast cancer is dealt with by a number of specialists from all over the world, representing actually all the major breast cancer treatment groups, at least from the Western world. It is also important because it always concludes with the so-called St. Gallen breast cancer consensus, where 50 of the world's most experienced specialists are coming together, trying to define how you should treat optimally breast cancer during the next 2 years. These conferences are taking place every other year. This is an interval long enough to have all the differences in treatment which have risen in the meantime to be discussed in this gremium. I think the conference is important because it is addressing the primary physician, the primary operating surgeon, gynecologists, the treating radiotherapists, the treating medical oncologists at the countryside, wherever breast cancer is treated clinically. It is not a research-oriented conference, also its program in the beginning has 4 of the 10 sessions mainly concerned with basic research and all the developments of therapy which have arisen during the last 2 years. But it is a conference for the treating physician, treating breast cancer all over the world, in all the cultures from the west to the east. What is the take-home message? I think the consensus, which is always given at the end of this conference, is what you should take home. And this consensus on how to optimally treat breast cancer in the future is the important part of it. This consensus is always published very quickly, within a few months only after the conference, in the Annals of Oncology, one of the major oncology publications worldwide. Where do we expect major changes? I think there will be changes in the surgical part. There is the controversy on how to deal with the axilla. There is still some controversy about tumor margins and all these more surgical parts of the primary treatment of the disease. But the major part, I think, is going to be in the biochemical field, because all these new methods of molecular profiling will probably going to change the selection of patients for adjuvant medical treatments. And these medical treatments are also proliferating. As you know, we have not only the cytotoxics today and their combinations, but we have more and more so-called biologically targeted agents which are entering the field of primary treatment of breast cancer. And this is a field where we expect at least some kind of guidance and progress from the next St. Gallen International Breast Cancer meeting to come.